My name is Dr. Geeta Ganesh, and today we are going to talk about multiple sclerosis and fatigue. I have no disclosures relevant to this talk. The objectives for this presentation are as follows: to give an overview of fatigue and multiple sclerosis, to discuss different types of fatigue, to discuss non-pharmacological or behavioral modifications used to treat fatigue, and to discuss medication interventions used to treat this issue. Fatigue is one of the most commonly reported symptoms by people with multiple sclerosis. In fact, about 75% of people with MS report fatigue. We know that fatigue is an important factor determining overall well-being and can contribute to disability. Notably, fatigue is reported to be the worst symptom of multiple sclerosis in more than half of people with MS. The tricky thing about fatigue is that it is one of the invisible symptoms of multiple sclerosis. It is not something that others can see. There are multiple visible and invisible symptoms of MS. The visible symptoms are ones anyone can see, and these include the ability to walk, tremor and other abnormal movements, and your ability to speak. The invisible symptoms of MS are ones only you see or only you experience. These include fatigue, cognitive or memory problems, pain, bowel and bladder issues, and mood issues like anxiety and depression. Fatigue can be broken down into two main types. The first is motor or physical fatigue. Oftentimes, patients will say they become weak or physically exhausted after activity. For example, a person's walking may look normal when they first walk into a big store, but they may have difficulty walking after 10 or 15 minutes of activity and need to use a scooter. Patients with this type of fatigue may benefit from having a disability placard so that they do not become exhausted when walking a long distance from the parking lot. The second type of fatigue is excessive daytime sleepiness. This type of fatigue is characterized by becoming sleepy and dozing off during the day, especially when reading, watching TV, working at the computer, and sometimes when stopped at a red light in traffic. We do not know what causes fatigue in people with multiple sclerosis, but there are several theories. These include problems with the hypothalamic pituitary adrenal axis, the presence of inflammatory cytokines or small signaling molecules in the brain, and cardiovascular dysregulation coming from the brain. When assessing fatigue in a person with multiple sclerosis, it is important to screen for other causes of fatigue and treat these conditions. Conditions that commonly cause fatigue include sleep disorders like obstructive sleep apnea, insomnia, and restless leg syndrome, thyroid problems, anemia, mood disorders like anxiety and depression, and medication side effects. These are all common causes of fatigue in people with and without multiple sclerosis. Many times, fatigue will improve if these secondary causes are treated. Now I would like to talk about non-pharmacological or behavioral treatments for fatigue. These include exercise, energy conservation management, and cognitive behavioral therapy. Although it may seem counterintuitive, many studies have demonstrated that regular exercise improves fatigue in people with multiple sclerosis. Energy conservation management is a treatment aimed at teaching patients to reduce the impact and severity of fatigue by analyzing daily work and leisure activities and balancing work and rest, organizing workspaces, learning to communicate needs to others, setting boundaries, and modifying priorities and standards. Cognitive behavioral therapy is a therapy aimed at confronting and changing irrational beliefs and thoughts at the base or root of maladaptive behaviors. All of these treatments have been shown to reduce fatigue or the burden of fatigue in people with multiple sclerosis. There are several medications to consider when treating fatigue. For motor fatigue, we sometimes use a drug called delphampridine. This drug is not a stimulant, but instead works by blocking potassium channels. It is a pill that is taken twice per day and may improve walking speed in some people. This drug does lower the seizure threshold and should not be taken by people with a history of seizures. Amantadine is another drug sometimes used to treat fatigue and multiple sclerosis. This drug is a twice per day oral medication. It tends to be well tolerated, but some people report side effects such as difficulty sleeping, mood changes, and in extreme cases, hallucinations, dry mouth, nausea, constipation, and a decrease in blood pressure when standing, which may lead to lightheadedness. Modafinil and armodafinil are stimulants that work through the dopamine pathway. These drugs may be taken all at once in the morning or be taken upon waking up in the morning and again at noon. Side effects are similar to that of caffeine and include difficulty sleeping, palpitations, increased anxiety and irritability, decreased appetite, nausea, and headaches. The last class of medications we use to treat fatigue in multiple sclerosis include methylphenidate and a combination of amphetamine and dextroamphetamine. These drugs work by promoting the release of dopamine and norepinephrine. Dosing may be all at once in the morning or in the morning and again at noon. Side effects include increased blood pressure, difficulty sleeping, restlessness, anxiety, irritability, palpitations, decreased appetite and weight loss, and nausea. These drugs are highly controlled substances and have a fairly high potential for abuse and dependence. Interestingly, even though we often use drugs to treat fatigue and MS, the evidence that these drugs are effective is actually quite low. These drugs have not done well compared against placebo in some trials. It should be noted that the number of patients studied in other clinical trials has been low. Overall, we do not have good evidence for using these drugs to treat fatigue and MS. In conclusion, fatigue is a very common and disruptive symptom for people with multiple sclerosis. The cause of fatigue in multiple sclerosis is unknown, though there are several theories. It is important to assess for other common causes of fatigue in people with MS. Non-pharmacological treatments like energy conservation management and cognitive behavioral therapy may be more effective and safer than using medications. Thank you for watching this presentation.